Good day, all. This talk will take a brief look at how health and healthcare work. I shall focus on 4 key variables which determine health: nutrition or diet, exercise or physical activity, sanitation or cleanliness, and of course, healthcare. I shall provide a brief history of each of these, examining them in each of the 3 main types of society: hunting and gathering society, agricultural society, and industrial society, focusing primarily on modern industrial society. Early hunting and gathering societies had an excellent diet because they ate lean wild meat and green vegetables. This is the diet that the human body evolved on, and it is still the best possible diet. Their exercise consisted of walking and running while hunting and gathering, and swimming while fishing. These lower body exercises are also the healthiest possible exercises. Their sanitation was good, because tribes had small populations and were nomadic, so they just buried their waste and moved on. Their health care consisted primarily of herbal medicines prepared by the medicine women. Since women gathered the herbs and did the cooking, women developed techniques for turning them into medicines. And while they were not as swift or as potent as modern chemical medicines, they did work. People would not have used them for thousands of years if they did not. Since all 4 factors were positive, hunter-gatherers were generally healthy and strong, with very low rates of disease. However, there came a time when hunting and gathering could no longer support humanity's ever-growing population, and so people invented a new way to provide food: agriculture. Agriculture greatly increased the food supply and so triggered a population explosion. However, agriculture also introduced class inequality into society. The ruling class, the aristocracy, continued to eat well, but the majority, the peasants, ate only what they grew, which mostly consisted of crops like rice, wheat, and potatoes. These crops lacked essential proteins and vitamins. So, while the peasants did not suffer from starvation, they did suffer from malnutrition. This undermined their immune systems and left them open to disease. Farming did still provide them with good exercise, although the focus shifted to upper body exercise, which is not as healthy as lower body exercise. Sanitation levels declined. Agriculture meant an increase in both the human population and the domesticated animal population, and a switch from nomadic to sedentary society. This meant a build-up of human and animal waste, which spread disease. Healthcare was put under the control of organized religion, which rejected medicine and instead advocated prayer, which didn't help much. In short, all 4 factors saw a significant decline for most of the population. The aristocracy, who were rich enough to afford better food and living conditions, stayed strong and healthy. But the peasants, who were the majority of the population, became sickly, disease-ridden, and short in both stature and lifespan. The coming of industrial society in the 18th century once more greatly increased the food supply, and while that again led to a population explosion, still, industrial farming steadily improved the average person's diet. By the early 20th century, the majority of the Western world was eating a healthy, nutritious diet. But the second half of the 20th century saw the rise of the fast food industry. This generally supplies unhealthy, fattening food, which has led to a massive increase in obesity and obesity-related illnesses. This rise in obesity has been accelerated by a decline in exercise. Most physical labor is now done by machines rather than people. Most jobs now consist of sitting at a desk and working a computer. Industrial society is the first society in history in which the majority of people do not get enough physical activity to maintain a proper level of fitness. As a result, we now have the fattest and least fit population ever. In early industrial society, sanitation levels plummeted. In the 18th and 19th centuries, cities arose with populations in the millions. Most of them had completely inadequate plumbing, sewage, and waste disposal facilities. The result was that they became breeding grounds for disease, and health levels declined. Only in the late 19th century did most Western cities build proper sewers and improve sanitation. The result was that the early 20th century saw a major improvement in the Western world's health and life expectancy, which has largely been maintained to this day. Access to clean water and proper waste disposal are probably the main reasons that the West today has much better health standards than the world's poor countries, which often still lack such facilities. That brings us to the final item I shall examine in this talk, the evolution of healthcare in industrial society. The scientific study of human biology began in the late 15th century with the work of people like Leonardo da Vinci. Perhaps you've seen his famous drawings of the inside of a human arm. However, for a long time, anatomy was considered an academic subject with little practical application to medicine outside of the military. Military surgeons had to know how to sew up soldiers' wounds. They had to know anatomy to sew the right parts together. However, since they knew nothing about germs and did not operate under antiseptic conditions, most of those who went under the knife died, either on the operating table or of post-operative infection known as sepsis. Surgeons earned the derogatory nickname of sawbones and saved very few lives until germ theory and antiseptic techniques were developed in the late 19th century. In addition, prior to the 20th century, most physicians administered what was called heroic therapy, which these days is termed shock therapy. It was believed that a major shock to the system would expel the illness, a theory which in most cases is incorrect. Techniques for administering such a shock included bleeding, blistering, and prescribing a variety of substances now known to be poisonous, such as arsenic. These techniques were generally painful, ineffective, and did far more harm than good. As a result, surgeon physicians were not popular. Sick people would go to them only as a last resort, and often not even then. Most surgeons also worked as hairdressers and usually made more money from their scissors than their scalpels. In short, it was only in the late 19th and early 20th centuries that modern medicine actually began to improve people's health. However, what early doctors lacked in effectiveness, they made up for with social connections. The only people who could afford to go to medical school were the children of the wealthy. They were part of the upper crust, the modern ruling class. As such, they were personal acquaintances or even family members of rich business persons and politicians. For this reason, they had the support of Western governments, which in the 18th and 19th centuries repeatedly passed laws giving such doctors a legal monopoly on the right to practice medicine. These laws had mixed effects. On the one hand, they helped to get rid of the many quacks who existed, such as traveling salesmen selling patent medicines which consisted mostly of alcohol. But on the other hand, they also outlawed those who were practicing effective traditional medicine, such as herbalists and midwives. However, in rural areas where there were very few doctors anyway, most people ignored the law and continued to, wisely, prefer traditional medicine to heroic therapy. Public attitudes towards doctors only really improved in the 1920s. This was when the Chemotherapy Revolution began. The development of the first effective drugs, above all penicillin and other antibiotics. Antibiotics gave doctors their first effective treatment for disease. This made them really useful to a civilian population for the first time. Surgery greatly improved in the late 19th century, but civilians needed surgery relatively rarely compared to soldiers in battle. Disease was a civilian population's main health concern, and penicillin was hailed as a miracle drug for its swift cure of previously untreatable illnesses. The basic techniques of modern medicine became known as cuts and chemicals, or surgery and pharmaceuticals. But while penicillin was invented in 1928, it did not become widely available to the general public until after World War II ended in 1945. Modern healthcare does not just need drugs and equipment. It also needs a social structure capable of delivering healthcare to the sick on a mass scale. This structure was established by governments throughout the Western world as part of the post-war project of building the welfare state. Health, education, and welfare were established as the three pillars of the welfare state, the main areas where the state needed to intervene to ensure the well-being of its citizens. Britain led the way in 1948 with the establishment of the state-run National Health Service, or NHS. Continental European countries established similar organizations soon after. Canada followed suit with the introduction of federal Medicare in 1966, while the US, home of the world's most powerful corporate sector, introduced much more limited state support, only funding the elderly and the most needy through its own Medicare and Medicaid programs, and more recently, Obamacare. But, with the partial exception of the US, it was the state which built the modern healthcare system throughout the Western world. In addition to doctors and drugs, this healthcare system needed two more components to operate: nurses and hospitals. Modern nursing began in Britain in the mid-19th century, pioneered, of course, by Florence Nightingale. She established the first nursing schools, created the first trained nurses, and turned nursing from something done by nuns and charity workers into a paid profession requiring vocational education. Nursing schools on the Nightingale model spread throughout the Western world in the late 19th and early 20th centuries. However, nurses needed somewhere to work, and that somewhere was hospitals. The post-war years, especially the 1950s, saw Western governments invest large amounts of money in the building of new hospitals. These hospitals became the centerpieces of the modern healthcare system. While doctors continued to have their own clinics, any major treatment, such as surgery, had to be done in a hospital. The problem with hospitals was that prior to the development of germ theory in the late 19th century, doctors had no understanding of the importance of good sanitation and hygiene. As a result, most hospitals were filthy, unsanitary, disease-ridden places the patients rarely left alive. This only changed due to the introduction of nurses. Nurses, led by Nightingale herself in the 1850s, did the women's work of cooking and cleaning. In other words, they introduced proper standards of nutrition and sanitation, which male doctors were completely ignoring at the time. Nurses literally cleaned up hospitals and turned them from places you went to die from your illness to places you went to recover from your illness. This is why nurses and hospitals rose in importance together in the 20th century. By the 1960s, the Western world had the best healthcare system in history. It was well funded by the state. It was run by educated medical professionals. And it had effective techniques, including surgery, drugs, and a whole host of new treatments made possible by newly invented medical technology. Its only problem was that it was too successful. The state had expanded spending on healthcare until it was a multi-billion-dollar industry. This made it very attractive to the private sector. And so, beginning, of course, in the US, the late 70s, 80s, and 90s saw a major push by corporate healthcare to replace state-run healthcare. This was made possible by a wave of politicians of what was then called the New Right, such as Ronald Reagan in the US, Margaret Thatcher in Britain, and Brian Mulroney in Canada. They introduced cutbacks and began the systematic underfunding of healthcare, supposedly to save money, but in practice to pressure the general public into turning to private healthcare. State-run healthcare services were put through a process of privatization. The late 20th century saw a major expansion in private healthcare throughout the Western world, but to by far the greatest degree in the US. Following President Reagan's introduction of his policy of deregulation, healthcare in the US was almost entirely taken over by private corporations in the space of just a few short years in the 80s and 90s. The result was the creation of a two-tier healthcare system, one for the rich and another for the rest. By the early 21st century, about 3/4 of all healthcare resources in the US were being consumed by the richest 10% of the population, leaving the other 90% to get by on rich people's leftovers. Millions of average Americans have already had to declare bankruptcy when they got their exorbitant medical bills, while millions more now have no healthcare insurance. As a result, after rising throughout the 20th century, average health standards and life expectancy in the US have been falling in the 21st century. In the late 20th century, Europe and Canada also began to privatize healthcare, albeit much more slowly. But in the 21st century, that privatization has largely ground to a halt, primarily because of the example being set by the US. Through the mass media, the whole world has learned that the corporate healthcare promoted in the US is just too expensive for all but the rich. Public opposition to privatization has grown, and politicians have had to listen to this. In Canada, the public and private sectors exist in an uneasy compromise. About $1 in 3 that Canadians spend on healthcare goes to the private sector. In other words, healthcare in Canada has been about 1/3 privatized, and this has not changed significantly over the last quarter century. The private sector has not grown, but neither has it shrunk. As always, the private sector would love to expand its share of the market, but the majority of Canadians remain firmly opposed to this. Medicare has become part of Canada's national identity. Universal health care, guaranteed by the state and paid for collectively, is part of the Canadian way of caring, cooperation, and compassion, in contrast to the American way of cutthroat competition, individualism, and profit-making, even at the expense of the sick and infirm. The future of healthcare in the Western world is currently uncertain. Will it be public or private? Will there be one healthcare system for the rich and another greatly inferior for the rest? Or will good universal healthcare be recognized as an inalienable right of every citizen? Will we follow the example of agricultural society, where the ruling class had far better health than the common people? Or the example of hunting and gathering society, where healthcare resources were equally available to all, and health was the concern of the whole community. Only time will tell which of these paths modern healthcare will go down. In conclusion, the story of modern medicine is partly a story of new technology, discoveries, and inventions steadily improving healthcare. But it is also partly a story of conflict between different groups of caregivers who've tried to take healthcare in different directions. In recent years, traditional practitioners like herbalists and midwives have managed to make a place for themselves alongside industrial healthcare, but so have modern corporations, promoting a very different model of healthcare. The conflict between public and private healthcare remains a key issue in today's world. I have more to say on the struggle over healthcare in my talks on how health and healthcare work in over 30 minutes. But for now, that concludes my look at how health and healthcare work in under 30 minutes. A transcript of this talk is available if you're interested. Good day all.